Dr. McDonald, what is the current COVID situation like for BC First Nations?
Melissa, it's been challenging, shall we say, since the beginning of January. To this point, we have 3,752 cases. That's cumulative for the whole year. And we've got over 900 active cases right now. So it's been very, very busy.
What are the challenges in getting the numbers down for specific to BC First Nations?
What we've seen really obviously was the spike in cases from the end of December until mid to late January. They've just started to come back down now. But a lot of that had to do with people gathering over Christmas. People who really didn't respond well to the direction to stay home and stay away.
I think that's been the case. I've been talking to doctors in Manitoba, Saskatchewan, Alberta, and it sounds like it's the exact same thing in BC. People weren't listening to the distancing requirements and were gathering. So the rollout of the vaccine, what's that looking like in BC?
We've done really well. We have a good partnership with the province, which is very helpful. We have delivered more than 13,000 vaccines in 81 communities.
Wow.
Now we are just waiting for the next delivery of allotment of vaccine. We've been using Moderna because we've started with our most remote and isolated communities and are moving inward to the communities that have greater access to healthcare services. So it's been a challenge. Our logistics guys have been brilliant.
Earning their keep.
Yep.
Well, we have a couple questions from viewers. Somebody has asked, can I still pass on the virus if I've had the vaccine?
The honest answer, Melissa, is we don't know for sure. We do know that the first dose of the vaccine definitely decreases the chance of somebody having serious illness by over 90%. The second dose makes it last even longer. What we don't know yet is whether or not somebody can be colonized. In other words, that the vaccine can take up residence without causing illness. That's being studied, but in the meantime, we're telling people to be very cautious, and even though you're protected, your job is to take care of everybody else at the same time. So continue to mask, continue to distance until we have a large enough proportion of the population immunized that risk goes down.
Somebody else had asked, if you receive the vaccine, do you have to take it every year, or is it one shot is good forever?
Again, we're not too sure. If you think of like the flu vaccine, we get a different flu vaccine every year because the flu changes its clothes, for lack of a better term, becomes a variant flu. We know already that COVID can create variants, that there are at least 3 variants we're following across the world right now. And so far, the vaccines look to be effective against those variants, but we don't know if there are going to be new variants and if we may have to adapt to that by creating a newer vaccine going forward. We're hoping that after a second dose of the mRNA vaccines that people will have a long-lasting immunity, but we don't know yet.
And these vaccines don't cost anything. Everybody gets them for free. That was another one of the questions we had.
That is correct. The Canadian government are the purchasers of the vaccine. They distribute them to the provinces, and ultimately they're distributed down to the level where we can provide them to First Nations on reserve. Regional health authorities in BC are responsible for the off-reserve population, but we work in partnership with them to make sure that people are receiving vaccine in a culturally safe and accessible environment.
Perfect. Well, thank you for taking the time to share your thoughts with us on this and update us on the information or the situation that's going on in BC. Always great to see you, Shannon.
Always great to see you. Well, at least hear you. Thanks, Melissa. Take care.
Bye.
Bye-bye.